So let's have a look at whole body irradiation. So you're irradiating the whole body, not a local thing. Excuse me. So give 2 gray. That will induce radiation sickness. So that like vomiting, diarrhea, that sort of stuff. And that's because there's a significant number of intestinal cells killed. 1 to 10 gray, so there's a bit of overlap. There can be this can lead to death due to shutdown of the immune system within weeks. So initially what will happen here, and within in a few grey, the patient will actually get initially sick, and then they will start to feel a little bit better, and then after a few weeks, or about 2 to 3 weeks, they will get sick again and die. So initially they get sick from this radiation sickness, and then they get better because their bone marrow and their immune response kicks in, and so that makes them better. But because the bone marrow has been killed off, the antibodies and the immune system can't regenerate, and so what's going to happen is you've only got a couple of weeks of reserves in your immune system, and so that's why you get sick again later on. So there's a delayed response here of one, like in sort of a few grey, probably 10 greys is too much. You can survive this if you have transfusions and bone marrow transplants, antibiotics, but without that you're unlikely to live longer than a few weeks. 5 to 20 grey, the effect is on the small intestine. Once you hit 10 grey, at least you get internal bleeding, and death will occur within a few days due to the gastrointestinal syndrome. And the prognosis is not good for people. 20 to 50 grey, you start to affect the nervous system, central nervous system. You get the cerebrovascular syndrome, so the cerebral fluid will be affected, and you'll get death within 1 to 2 days, and there's nothing that can be done to save someone who gets this amount of radiation dose. If we look at if we put this into the time before death, or time between radiation and death, if we have a dose of 1,000 grey immediately, you will get immediate death. Doses of about 100 grey, you will die within 1 to 2 days. Doses of 10 to 100 grey, about 3 to 10 days. 2 to 10 grey, about 10 to 60 days. And that just depends, again, on the person and the state of health that they were already in. If we look at the whole body irradiation, the central cerebrovascular syndrome, the central nervous system, always fatal. Death appears to be a result of elevated fluid content of the brain, and observed damage to the nerve cells in the brain and the blood vessels in the brain. If the head alone is irradiated, you can get much higher doses to produce death, but I'd still recommend it. Gastrointestinal syndrome, that's always fatal again. The primary damage is to the gastrointestinal tract, and death is caused by problems with absorbing metabolites, fluid loss, electrolyte balance, and infections. The hematopoietic bone marrow syndrome, so this is damaged by reduction in the number of circulating blood cells, so white blood cells and red blood cells. The damage is direct destruction of the white blood cells, so you get hemorrhage and inhibition of blood cell production. and this causes a loss of the different types of blood cell. Recovery is possible for doses of less than about 4 gray, and with no medical support. Yes, maybe. For 3 to 8 gray doses, maybe antibiotics and bone marrow transplants can help. Without such treatment, you're going to get death in 3 to 8 weeks. So you can see these numbers are sort of tend to vary from slide to slide. It's yeah, there's a bit of variation there. Excuse me. Somatic effects. These are effects which exhibit themselves within the lifespan of the irradiated animal or person. The most important one is radiocarcinogenesis, and the induction of cancer caused by the ionizing radiation. Alright, let's have a look at whole body irradiation, the lethal dose, the LD50. So lethal dose, so LD50 is the dose which causes 50% of the exposed population to die without medical treatment. So defining the LD50, the reason why is because the dose response is not the same for everybody. So we're looking at an average or a distribution. So it's it's just a measure of radiation lethality. The one thing that probably is used is the LD50-30. Right, so the LD50-30 is the radiation dose which will cause 50% of a population to die within 30 days. So the 50-30 is what you get. Factors which modify this, again, dose rate, type of radiation, partial body shielding, various medical reasons, and the amount of oxygenation. So let's have a look at these. Let's have a look at some tissue reactions. So dose rate. So the dose rate affects how well an organ will respond. So let's look at sterility. A single dose of 0.15 gray will cause temporary sterility in men, but if you prolong that over to 0.4 gray per year, that will cause it. So there's a difference in the dose rate, and then you can see there's a bit of an inverse here for permanent sterility, and for permanent sterility in women, there's a single dose of 2.5 to 6 gray, or a prolonged dose over a year. If we do whole body irradiation, the LD50-30 is a radiation to the whole body that results in death within 30 days to 50% of the exposed population. So here's an example of different types of animals. So dog can take 2.75 gray, human about 3.5 gray for LD50-30, goldfish a little bit more, rats, turtles, cockroach 100 gray. Cockroaches are much more radio resistant than most other animals. So going back to the first lecture, so ICRP set equivalent dose limits to avoid deterministic effects based on threshold doses. So these are for skin changes and vision impairment and cataracts. So if we look at this, this is where these radiation weighting factors come into it. There's no radiation weighting factor for the lens of the eye for some reason, I don't know why. But this information is based on cancer induction, which is not a deterministic effect. For the skin, we need to differentiate between stochastic and deterministic effects. So stochastic effects, so this is cancer induction. This affects the basal layer, but deterministic effects affects the dermis. The recommended annual limit for effective doses is set at a nominal depth of 7 milligrams per square centimetre, and it's 500 millisieverts occupational dose or 50 millisieverts for public dose. And we'll come to that when we do dose limits. Guidance on averaging is given in the ICRP document. So lens of the eye, so ICRP 41 looks at formation of cataracts in the eye. So ICRP 60 recommends annual dose limits of 150 millisieverts, which is what is in effect in Queensland, for occupational, or 15 millisieverts for public exposure. Again, we'll come to that when we do, in a few lectures time, when we do limitation. Looking at internal organs, so radiation can be absorbed through your food if you absorb radioactive substances in your food, or otherwise you can breathe them in. So internal exposure is limited to an effective dose of 20 millisieverts by ICRP 61. Intakes are averaged over 5 years. Radioactive substances taken in have to be considered as well. And again, we have a later lecture on that, so we'll get into that a bit more later. With exposure of women during pregnancy, so pregnant women are a vulnerable group because of the requirement to protect the unborn child. So the child is considered to be more sensitive than an adult. And so we don't want to cause accidental exposure, which can cause more harm to the child than the actual mother. So once, if a radiation worker becomes pregnant, once a pregnancy is known, the ICRP recommends that the mother's exposure needs to be limited to the general public exposure. Again, this will come up in later lectures. That's all for this week. Don't forget to do the online quiz, and I'll see you when I see you.